Just like physical health, mental health is something we all have and something we all have to look after. For employers, having a happy, healthy workforce means having a productive, profitable workforce, and it helps the business to tick along. But life is hard. Life is full of challenges. There's always something on the news to worry about. There's always curveballs being thrown at us left, right, and centre. It seems that just getting by day to day can be a big challenge in itself. I'm recording this in Mental Health Awareness Week, which this year runs from May the 11th to May the 17th. And I had a conversation today with Neil Lovell, the CEO of the printing charity, who are very keen that we all take our mental health seriously. This year, they've issued guidelines based on the NHS's 5 steps to mental well-being, things we can do to look after and safeguard our mental health. Among those, we have give to others, show appreciation, be grateful, recognise the effort of our colleagues, connect with others, make time for catch-ups, whether that's over lunch or coffee or just a quick how are you to the people we work with. Learning new skills can help us feel positive and keep ourselves balanced and look after our mental health. And being physically active is crucial. Looking after our physical health is fundamental to our mental health. Getting enough sleep, getting enough exercise, eating properly, and being mindful, taking a moment to slow down when we can. But there's more to that than just lifestyle. Sometimes it can all just get a bit too much. So that's where organisations like the printing charity can help. So if you want to get in touch with anybody, or if you feel the need to reach out, you can get in touch with them on 0333 212 3534. And that can take place any time of the day or night. And there's always someone willing to talk. If you're an organisation as well, you can get in touch with the printing charity and they will offer you resources you can offer to your employees. Anyway, before we talk any more about what's available to you, maybe we should hear it from Neil Lovell, CEO of the printing charity himself, as we get into this special episode of the Digital Printer Podcast. So Neil, thank you for joining us today. We're recording this during Mental Health Awareness Week, and the printing charity is quite heavily concerned about mental health. It's a big issue for everyone nowadays, I suppose. There's, a cost of living crisis, work, especially in a production environment like print, can be quite demanding. Why do you think it is such an issue in the print industry?
Well, I mean, thank you for having the conversation, Chris, because it's always good to talk about what we do, but also, why we do it, because it's actually in direct response to the needs of our sector. So, and in some ways, it's not unique. Our sector is not unique in the challenges that people are facing around, the workplace challenges, anxiety, stress, all of those areas. But of course, we live in a very kind of complex and connected world now, don't we? And whether that's at work or outside of work, and actually that's creating some of the challenges that people are indeed facing. And for some organizations, that's they can manage those quite easily. They've got things in place. For others, and not just in this sector but in other sectors as well, then there's more help that's needed. There's more support that's needed to put things in place for employees, because we live, a lot of our life is actually at work, isn't it? But actually our non-work life also brings with it challenges and stresses depending on where you are in your life as well. So, it can be a complex picture. And I think that's why we try and create ways to respond to people. I mean, you roll in COVID, Chris, and, not that long ago, and that exacerbates so many issues that I think people are now facing.
Absolutely. And I mean, it's going to be quite hard for businesses to tackle mental health, especially a business like print, where you've got people on the shop floor, you've got people maybe out in the field, you've got delivery drivers, salespeople, and people in the office as well. I mean, is there that, and obviously there's no kind of one size fits all solution to mental health. But what are some of the things that, businesses can do to make people feel more comfortable, make people feel more stable, make people feel like they can talk about this kind of stuff?
Yeah, and well, that's critical, Chris, isn't it? That make people feel as though they can talk. And I think whether you are on the shop floor, whether you're in an office, whether you're on the road, it's knowing that it's okay to talk about, how you're doing. And one size doesn't fit all. Absolutely right. It's making sure, in fact, what we try and do with through the helpline and through the other support that the printing charity offers through our wellbeing community, is to try and understand what that organisation looks like. How many people are on the shop floor, how many people are out on the road, to make sure that the communication that can be given is appropriate and is right. Not everybody wants to make a phone call. Not everybody absorbs information in the same way. But it's making sure that that is in as many formats as possible. Maybe it's a poster that goes up on the shop floor. Maybe it's something that goes on someone's desk if they're in the office. Maybe for the road warriors out there, it's something that they can carry with them or have in their car as well, should they need it. So it's trying to understand what is that organization's structure, how does it work, how does it communicate with its employees, the essential, no organization can run without them. How does it communicate? And then making sure that we create materials and we respond in the right way so that people can actually see what it is that we're talking about and can access our support. I found an interesting stat the other day, which was, something like half of Brits don't actually feel anxious about receiving or taking or making a phone call. So, I mean, with that means not everybody's going to want to phone our helpline, but they might want to interact with us online. And, so it's just making sure some of the ways in which people can communicate. It's one of our big challenges, to be fair, and something we're going to keep working on, is making sure that they can communicate with us when they want to, in the format and the right way that suits them.
Traditionally, print is a traditional industry, and traditionally Brits especially had this idea of kind of a stiff upper lip, and just get on with it. And if you show any kind of emotion, it's a sign of weakness and that kind of thing. There is still huge stigma attached to it. Do you think people are afraid to kind of speak up about their mental well-being in the workplace for fear of being seen as kind of not being up to the job, if you like?
I think there is still a stigma. But I think it's changing. And I think from the research that we've done, we know that our sector is supportive of conversations of its employees. But of course, for every organisation that's got things in place, there'll be more than one that hasn't. And it's not because they won't want to, it'll be because they haven't necessarily thought about how to do it, or they're concerned about doing it in the right way. There's a lot of fear, I think, from employers in terms of not wanting to make things worse. So what is it that we can do to be able to respond to people's needs, so that, that stigma, the biggest thing is just to make it, normalize the fact that people need to talk about life. Life hits you. Sometimes it's all right, sometimes it's not. You can't keep a lid on it forever. You need to be able to, feel as though you can have that conversation even at work. So I think the stiff upper lip still there for sure. Our sector is similar to others in that you'll still have some of that way of thinking. But culturally, and I think as you get more younger people coming in to the sector, then I think there's a different expectation in terms of what people want and, who they want to work for and the type of environment that is created for them to, be able to express themselves when they're not actually on top form. We all have those days, don't we? So it's okay to have those days. Doesn't mean to say you're a lesser employee, or that you shouldn't be frightened of that. But there is that, making sure it's okay to talk, and having a culture of that is still a very important aspect of any wellbeing program.
Yeah, absolutely. I mean, there are going to be people who say, life is tough, and you said, sometimes life hits you, and we just got to get on with it. We've got to kind of recognize that life is stressful. Work is called work for a reason. It's not always easy. So how do you know when you're struggling, and how do you know when this is just a hard day, or it's a difficult project, or whatever it might be? Where do you kind of find the boundary between those two things?
Gosh, well, we're all different, aren't we? So
Yeah.
for some of us, we know we're keeping a lid on things. For some of us, it might show through not being able to sleep well, not being able to, concentrate on things, finding everything an absolute drain. But presenting themselves, presenteeism is an area that, we know. exists across, the working world, because people are just not able to work through things, but it can present in very different ways for different people. We bring to ourselves into work who we are, but actually that also means the things that are happening outside of work as well. And I think finding what the issues are for yourself, sometimes it's about just allowing yourself to, be kind to yourself, make a phone call if that's something that you're comfortable with, to, the Printing Charity Helpline if you're struggling with something. You will know inherently probably that you are dealing with something, but you're just kind of bottling that down, pushing that away. But you need to be able to give yourself time and permission to be able to make something for you, make a phone call, connect, talk to somebody, someone you trust, and understand, that you're not on your own. You're not alone. There are people you can talk to, but we are all different, Chris, aren't we? So for some people, it may be something that as a catalyst for them recognizing they need some help to talk about things. For others, it'll be very obvious to them, but they just haven't made time for themselves. And I think that's really critical. Or as you said, maybe their employer is so busy trying to survive and get things rolling, because work is work, as you're absolutely right. This isn't about creating soft environments. It's about creating environments that are productive and healthy. And that means listening to employees, putting things in place, that will be good for you as an employer as well. Lost productivity, we all know there's some scary figures out there, the billions of pounds that it costs for people who are not productive. They're either not at work. 1 in 5 people, I think, have taken time out of work in the last 12 months because of mental health related issues. That's not good for productivity. It's not good for the individual. So, addressing that, trying to find ways, is really critical, Chris.
Recently, it was on the 11th, I think, which was Monday, 11th of May. And just a reminder to anyone who's listening, we're recording this in Mental Health Awareness Week. But you shared some steps to mental well-being, which were based on the NHS's 5 steps to mental well-being. And these were give to others, connect with others, learn new skills, be physically active, which is a big one because mental health is health, and they're two very connected things. Taking a moment to pause and breathe and be mindful during the day. And these put the onus very much on the individual. And of course, we need to take our health very seriously, and exercise, slowing down mentally are a big deal, especially in a world that feels like it's on fire sometimes.
Yes.
But what can employers do? I know employers are under a huge amount of pressure in terms of cost, in terms of staffing as a resource, and paying national insurance, all of these kind of things. I mean, are there things that employers can do to be proactive in the mental health of their staff and their teams?
Yeah, absolutely. And some do it really brilliantly well, and some want to do it well but haven't had the time to do it, or are planning to do it even better. Yes, there are lots of ways in which organisations can embrace this. From our own at the Printing Charity, from our own work, where we have our wellbeing community, which are all the businesses, over 500 across our sector. That's about 19,000 people. Have access to the helpline. Everybody has access, but we have for those organisations that work directly with us, we build a profile with them to understand what it is that we can do on top of the helpline. What are the other things we can offer to their people. But wellbeing champions that come out of that community are those that can actually have more information to be able to make sure that they can then adapt that and make sure it's appropriate for their workplace. So you may have an organisation that has every intent to create great well-being, but the feedback that we will get is that that's not always necessarily then delivered, because someone doesn't have time, they don't have the training, there's no resources available. So our response to that has been to create this community where all the resources are available for someone to download, to be able to understand what it is they can do to respond. So difficult conversations, or all of the areas around positive mental health, that's all there as a resource for people, organizations to actually then use and roll through into their whether you're an organization of 3 people or you're hundreds of people. Now, we know a lot of organizations are smaller, and that's why having this toolkit, having an immediate access to the helpline, is absolutely critical, because that doesn't, you don't need a big HR function for that. You need someone that we can talk to help roll these things out and for us to work with. But actually, all of that material is available, and that's a really big step forward this year for us to put that out there, to make the helpline number available to everybody in the sector, and to really raise awareness of what's available, so that people can then choose how they want to use it, what's appropriate for their environment, for their organization, and for the person inside the organization or people that have a responsibility, if you like, for communicating, for HR, maybe for other aspects of, staff well-being. There are lots of things out there, Chris. That's just
Absolutely.
our challenge is always getting to those organizations, because they're not always obvious. We
Yeah.
don't know every print business in the UK, no one does, but we've got to try and reach more and more to be able to try and make them aware of what's available.
You talked about this culture and training, especially. And I remember sitting in on a call that I think the printing charity ran last year with the BPIF, and there was talk of kind of mental health first aiders, and it's very important not to try and take charge of someone else's mental health if you don't have the training, because that can often make matters worse. How do I, if I ran a business, how would I go about, training up a mental health first aider? What would be the best approach for that?
Well, I mean, you could talk to us, and then we will make sure that you've not only got that access to that kind of training, so there are people that we can point you into the direction of, but also that you've got other materials around you, because even just having the title of mental health first aider means that you need to have a more awareness, a broad awareness of not just, I mean, most of the colleagues within the printing charity and all the RMs, who are the essential link between us and the businesses, have undergone mental health first aid training, not because they want to be prescribing, but to be able to understand what it is that may be needed in an environment, and so in a certain work environment. So if someone wants to do to build their capacity in this area, and they want to have a mental health first aider, then certainly they can talk to us, and then we will advise them on how best to kind of approach that. But as I say, it's not just that I've got a certificate, or I've got something I've done. It's making sure that all the other things, life changes, isn't it? Work changes, things are happening all the time. So that's a great start, and we would encourage every organization to have someone in place that does that. But it's all the other stuff that attaches around that, that's keep it moving, keep learning, keep understanding what it is that people may need from us, in the way that we're having to kind of adapt as well, and think it's not just about phone calls, it's about online resource, it's about it'll be about texting, it'll be about all of the areas that are important to be able to access people in the way that suits them.
In terms of the training, it's very important to have that resource available, but is there anything that we can do individually to support our colleagues? Any signs we can look out for to see if people are struggling or anything like that?
I think, well, there will be, in each different environment, it'll be just being open to a conversation, making sure that an organization is talking to, engaging with its employees, so that they feel that it's safe to be able to talk about where they're at the moment. Yes, there is this high pressure environment, absolutely. It's hard to imagine that's going to be taken away, because that's the nature of what this sector is about. It's hugely creative, it's it moves forward, it adapts, it changes. All of that brings challenges, doesn't it? So that, but making sure that people are aware that it's okay to try and seek advice and seek support. I think every organization can do that. It's about the culture. It doesn't happen overnight. It is about awareness and communication. So making sure that where you are in the workplace, you can see positive messages about how an organization is supporting its team. Just having something up there that says, here's the printing charity helpline, we are a wellbeing champion, we are a community that wants to support our employees. That's a strength. That's a superpower for an organization. It's definitely not a weakness. It's the ability to be able to make people feel, right, okay, yeah, I'm in that, I'm vested in that organization, I like working in that organization, they support me. So everyone can do that. And it's, talk to us again about how we might encourage and provide you materials to be able to do that effectively in your workplace.
And what about, I mean, we all think about our colleagues kind of on the shop floor and in the production environment. What if you're the kind of owner operator of a business and, you're there having to write the paychecks and you're seeing the costs go up, you're seeing, the challenges increase, competition is everywhere. What resources are available to you? Can these people also reach out to the charity
Absolutely.
or other people?
Yeah, we're all human, aren't we? So
Yeah,
even the person that's in charge, they will often carry the biggest, responsibilities and the challenges. So yes, we would encourage you need to make sure you're okay before you can help everybody else.
yeah.
It's that, what do they talk about in an airline? If
Put
the
your oxygen mask
oxygen
on
mask, put it
first.
on you
Yeah,
first. If you really are, and again, there are different ways. You might want to just talk to us about the challenges that you're facing in that moment. Not, it doesn't have to be all the big stuff. It could be just something that enables you to be able to move forward, to be able to, take back some of that control. So, just because you've got your name above the door, doesn't mean to say that you're immune. In fact, the
yeah,
chances are that you need more support and guidance at times. And again, it's an ability to look after you so you can look after others, and that's really critical.
yeah, absolutely. Um, so beyond sort of policies, beyond the workplace, and beyond even the printing charity, is there anything that we're seeing in the kind of wider society that is kind of hopeful in terms of the support that people need in government policy or anything like that? Are we seeing kind of a move to a more considerate society in
Yeah,
terms
I
of
mean,
mental health?
that's the big one, isn't it?
Yeah,
We're also having this conversation during a period where there's probably a leadership a
yeah,
challenge. So if you
absolutely.
want consistency or you want change that's positive, then you don't want all the other stuff that's happening around us politically right now, because that's just going to take attention away from what's important. But look, that's the world we live in right now, isn't it? So it's hard to see any really clear policy on how the government is helping organisations support their people through mental health, positive mental health. But let's see what comes down the line. What we do see from the research that we've done is that there is a huge amount of feedback about the positive environment that our sector creates for people, that it is an environment that listens. Of course there'll be challenges still, and there's more that can be done, but it is seen as a good place to develop. It's also seen as a place absolutely full of change, more so than perhaps other sectors out there. So it's going through huge changes all the time. People are, taking more responsibilities as a result of that change. There'll be change that's good for some and not for others. So, all of those kinds of things. But what we've seen from our research is that the general feeling is that there is support for people, that their organisation listens to their needs. But as I say, we need to reach many more organisations, because there may be the best intent out there, but not necessarily the resource to be able to do that, or an understanding. I think as you started off, there is sometimes a fear. People think, well, I can't have a conversation because I might make it worse. That's generally not going to happen. But so don't put your head in the sand. As an organisation, think about, you need to respond, otherwise you're going to be challenged by presenteeism. You're going to be challenged by people being off ill. All of those things. So put something in place. But no, I don't see a coherent policy initiatives around this area. So it's really down to employers, as it always has been,
Yeah,
to create the right environment. And as I say, we see that everywhere. Really brilliant. The fact that we've got 500 organisations, over 500, that is brilliant, because they are engaged in this area of supporting staff. They are functioning, these businesses are businesses that are thinking about the future, and about their employees, and that's hugely positive. So for us, I think we can see that happening in our sector, regardless of what's happening in the wider world. The wider world is slightly mad, isn't it, and crazy
Yeah,
at the
just a
moment in
bit.
terms of what it's doing, and that impacts on us. And for us, one of the really important areas around the support that we offer, it's not just to that person that works in that organization, it's to their immediate family. And as I said earlier, we've got, we bring to work ourselves, but actually when you're not at work, you've got all of these other things happening around you, which can really cause you huge difficulties, challenges, depending on where you are and what stage you are in your life. So, really important that people understand it's not just for that individual that works in the sector, it's for their immediate, their partner, their children up to a certain age, that's available. This helpline is available to them as well, and the support that we offer.
Fantastic, because of course we're not islands. We are
No,
part of wider networks, communities, whether that's at home or in the office, or beyond that as well. And I'm just going to come back to a couple of points in the Mental Health Awareness Week press release that you sent out
indeed.
earlier in the week, and just this idea about being physically active. And I know you know everybody needs to get more exercise and we need to eat better, but the idea of kind of getting more sleep, eating better, even things like drinking water, they're kind of fundamentals for a healthy lifestyle. But they're also things that are easily forgotten during times of stress. So, how do we remind ourselves to do those simple things when perhaps life is getting on top of this, or there are much bigger fish to fry, going on around us?
Yeah, that is hard, isn't it?
Yeah,
Because they are, as you say, really simple. It's very, and because they're simple, they're also easy to postpone
yeah,
or to
absolutely.
pause. And so, it really is down to the individual to, to actually recognize that, and to just don't try and do it all. It's incremental. Don't, if
Yeah,
there's something you'd like to do more, you're not walking as much as you should do, you're too sedentary, then just start by, getting up from your desk and walking around for a little bit. And, if you're not drinking enough water, then just buy a bottle and take it into work. Whatever it is that you need to do, you'll know in yourself. These are the simple things. What is so brilliant about those things is that we can all do them.
yeah,
Whether we choose to, as you say, something else will happen. But look after yourself. Think of it of that oxygen mask. You need to look after yourself from those simple things, but don't try and do it all. Also, don't beat yourself up if you don't do them all. We're very critical of ourselves, and we think, oh, we want that. We look at other things and go, look, they've got that perfectly right. No one's got it perfectly right. So, do the things that you can do, recognize maybe there's other things you can add to it, but, there'll be an inner voice somewhere that's telling you that you probably, should have had a bit more exercise that week, or done it. So just take a step. Every journey starts with a step, doesn't it? The first step, take a step, and, gradually build things into your life that are perhaps you've paused because other things have taken over. Because the alternative is, we don't really want people to be in such a challenging and anxious state that they can't actually function properly, and that doesn't help anybody. So help yourself, really.
yeah, absolutely. So if I was struggling, or if I was a business wanting to get more proactive in terms of employee mental health, and I wanted to get in touch with the printing charity, how would I go about that? What's the best way to do that?
Best way is to go onto our website, so printingcharity.org.uk, and that has the direct links in to talk about the community for businesses. So if they want to actually have more than just the helpline number, and they want to actually build, understand more about the resources, that all that information's on there. And that will also take you to the phone number, into their head office number, or indeed, if you look on our socials, so all kind of at the Printing Charity. On LinkedIn, you'll see us quite active as well. So connect to us in whichever way works for you through those socials, and ask us to respond. Just let us know that you're there, and that you want us to talk to you, and we will through the structure that we have relationship managers that are based around the country, so that we'll find someone that's as ideally as close to you as possible, that can actually then have a conversation with you about what your needs are as an employer, the size of the company, the types of things that you want to talk to us about, and then we'll put something together for you so that you've got the right response and the right approach to this. So yeah, come to us online first. There's phone numbers there and everything else. If you want to talk to us, then give us a call. All of that stuff's available. Go to the website and you'll see it there.
Fantastic. Great stuff. Well, thank you so much for that. It's a really important topic that doesn't get talked about enough, but it's reassuring to know there are organizations like the Printing Charity out there to help and support us when times get a little bit tough. So I appreciate your time today. Thank you so much for giving it up. And hopefully this will encourage people to get more involved and more proactive in their mental health.
I think so, Chris. Thank you so much for your support as well. It really matters. So thank you.
Brilliant. Thanks. So there we go, a great short conversation with Neil Lovell from the Printing Charity. Very much appreciated that he could spend the time to chat today about such an important issue for all of us. And as he said, a healthy, happy workforce is a productive workforce. So it's in the interest of all of us, whether we're business owners, whether we're working with our colleagues, and whether we're looking after ourselves, to take our mental health seriously. So thank you for listening today. And if you want to find out more about Digital Printer and you want to sponsor this podcast, or just even find out more about the articles we print and publish, then head over to digitalprintermag.co.uk.